Hello and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we're here bringing you an exciting topic today about gut types. We thought we would do something a little bit different and blame your gut for the way you're eating. So
only Janet can think it's exciting when you have gas, bloating, and belching.
But there are some very distinct categories that I'm sure each of you listeners out there will fall in to find out what is behind your cravings, why you're choosing the things you're choosing to eat. How can you change some of that? Are there natural things you can take, enzymes, digestion, probiotics, things like that, gas, bloating, belching issues? So, and we have some pretty good questions, too, at the end of the show. So stay tuned. We've got a very exciting show for you. So with that being said, I guess we'll just get right into the different types, and we'll let Dr. Lewis explain to us why people have that. And I'm not picking on anyone in particular, but we're going to start with the Candida Gut, which the bad habit, I got an eye look.
Can you and I still be friends?
I think. The bad habit where you notice that you might have a Candida gut is you crave ice cream, cookies, cupcakes, mostly sweets. Shall we go on?
Go ahead and beat me down while you get a chance.
There is an emotional profile that goes with these type people. They are worrisome. They worry a lot. They're anxious.
You'd never know that I worry ever.
No, you don't. He's very laid back, but those of us that know him a little bit better can tell at times because he cares. They're also obsessive. So an overgrowth of yeast in the digestive tract is related to dampness in the body, which is a Chinese medicine condition caused by eating too much sugar, dairy, and wheat. And honestly, those that take birth control pills are especially prone to this condition, which manifests as weight gain, phlegmy coughs, and sniffles, and a white coating on the tongue. So if you're always having allergies or you think it's allergies, could be that you're full of candida and you're feeding it eating these bad things. So the way to heal that, Dr. Lewis, eating lots of soups, stews, warm, starchy vegetables. Talk to us about probiotics, oregano oil type things, fermented foods. This is your particular category. So tell us how to get well from this if you are a Candida gut person.
You have to be persistent. And, you know, one of the things that I, unfortunately, or maybe fortunately, I don't know, I can listen to a patient. They pretty much will tell you whether they're going to fail or not. And they don't know it, but, you know, they'll set themselves up to fail. And you have to look at this also in a different context, because whether you have chronic inflammation or whether this gut imbalance is causing obesity, you're eventually going to wear out your joints. You know, knees, hips, spine. Of course, me being a chiropractor, that's part of what I always look at. One of the things, well, some of you know that we've been doing a lot of is rebranding. Is that the right term? Relabeling.
Yes.
Finding new, different, better.
Yes, and thank y'all for hanging in there with us, because I know the names are all over the place, and I realize there's not a lot of pictures on the website yet, but as you're listening to this podcast, there's probably going to be more by the time you get there. But yes, we appreciate you reaching out and asking us, hey, what's the new product? It's been interesting, and some of the gut type things that you would have been increased because of the extra stress.
Yeah, and you know, this has been a pretty stressful endeavor. It's been a good one. And for example, we just had Sherry write an email about, well, I'm looking for this, this, and this. What is it? And I told Brandy, I said, would you please answer her? And she immediately ordered. Sherry's married to our friend John, who brought in the kombucha. I'm still trying to brew kombucha with Saccharomyces boulardii and with another just bacterial probiotic. I don't know if I'm going to be successful at that, because John knows more about probiotic or kombucha than I do. But I'm a big fan of Saccharomyces boulardii. It is a probiotic yeast, and just briefly, it grabs the candida yeast, fungus, virus, all the pathogenic bacteria, grabs it, and then you go through, it goes, doesn't colonize, but goes through when you have the bowel movement. And I told Janet on one of them, I said, nope, we can't sell that because it's too expensive. She said, if you take the small scoop, it lasts 10 months. And I said, okay, it's not expensive. I apologize.
And we actually already sold out of it and are waiting for our next shipment with our green Wisdom Health label on it.
Yeah, but we do have it in a capsule, though, which is 3 billion CFUs, which is a pretty good deal.
And for people with gut issues or this type of Candida gut, they might want to start with the capsule, correct? Because sometimes when you start killing Candida quickly, it's not pleasant.
Yeah, you kind of want to start slow and work up. So we got the big powder out. She started me at 9 billion. And then went to the big scoop, which is 45 billion. When my diverticulitis is flared up, I take 45 twice a day. Then we have a new probiotic, 100 billion, and it's got the Bifidobacterium longum, Lactobacillus acidophilus, rhamnosus, the Bifidobacterium bifidum, and lactus, and then Lactobacillus paracasei. And a lot of things, probiotics do different things. And I was at my dentist last week, and she said, do you floss? And I said, not like you want me to. And she says, you have an amazingly small amount of plaque on your teeth. And she says, what are you doing? She says, because Janet has proved to me that you can do things with natural products that I had never seen before. And I said, well, all I do is throw in some probiotics. And that was a question the other day from a pilot up in Iowa that's moving down to Bloomberg. What do you what do you rinse with? And that's Probiotic Synergy. It's a loose powder. My granddaughter says it's the magic unicorn sprinkles that makes her healthy. So, they taste good, but you put them in your mouth after you brush your teeth, you're ready to go to bed, and then let those things grow. They do help eat off the plaquing of your teeth. There's just one of the things I see is people say, well, they're going to try. And people that say try, that's a 90% chance you're going to fail. Because I tell people, you either do it or you don't. Don't say try. They say, well, I'm going to try to come to your party. 9 times out of 10, they won't show. But they'll try fiber or probiotics for a month or so and then quit. Well, I've read plenty of research that says, well, if you've taken 1 to even 10 rounds of antibiotics, some research says you never get your gut microbiome completely re-inoculated, and I don't think that's true, but some research says it is. I think it can take months and many times actually takes years. So when you jump into trying, there's the word, to get healthy, you need to stick with it. All of my patients that are healthy and have great results are the ones that stick with it. So you got to kind of keep with it for quite a while. There's things that I've talked about many times before. There's a lean gut type and an obese gut type, and that depends on the type and the amounts of gut bacteria. It's better if you give probiotics after any kind of medical procedure, because the antibiotics, and our medical profession, of course, does a really good job, but sometimes we really need to re-inoculate. And I would say do it every day for at least 6 months after surgery. We're even doing that to our dog after her little surgery the other day. Microbiome is incredibly important. The bacteria are incredibly important. I've talked about how some guy, it's kind of a Russian name, I'd butcher it. He won the Nobel Prize in Medicine in 1908, I think it was, for probiotic work, and we're still not practicing that. So the babies are healthier if they're born vaginally because they get more of the good bacteria on their skin. They're healthier than babies that are born with C-section. So you have to pay attention to that. And I have plenty of patients that come in and say, well, okay, C-section, what do I put my baby on? And you get a lot from breast milk. It's better if you can breastfeed. Actually, it does come through the breast milk, and that's, I don't know, you get a little bit of bifidobacterium, and you get a lot of the bacillus too. Healthy guts for infants. We're having more and more children that have ADD, ADHD that get incredible results with a combination of two different probiotics. One of them's the Saccharomyces. I'm kind of getting ahead of myself here, but that's not unusual. So breast milk, if you can't or don't breastfeed your baby, you need to very, very much increase the probiotics that you give your child to help that. There's an article, Some of Our Best Friends Are Germs. You should look that up and read it. It's really, really good.
So when they have the Candida type gut, things to avoid are dairy. She
bought me ice cream last time.
She's
nice to me. She doesn't say anything.
I try to help his emotional side.
Thank you.
It's going to be the things that you like. The things to avoid are dairy, sugar, refined grains, raw foods, and yeast. So, interesting, huh? So,
yeah, folks, I got the look on that.
He's processing.
Yeah.
The next type category we have is the gastric gut, and we probably know somebody who falls into this category, or you do yourself. The bad habit is inhaling your food in large portions of it. Their emotional profile is they're fiery, passionate, and reactive.
Have a little bit more tendency to have high blood pressure and heart conditions because of that fiery disposition.
What it means is they're overworking and overexertion are the biggest reasons why people come down with gastric gut. And they explain with this type of especially slow-moving digestive systems, as a result, things that hamper digestion further. They already have a bad digestion, and then they don't chew properly because they're inhaling their food. They're eating way more than what their portion size should be. And then they get acid reflux and heartburn, and so they have to start taking antacids, which is going to cause issues like gas, bloating, and acid reflux. So maybe you can talk or explain to the people out there that have this issue when they're loaded up on the the heartburn type medications, what's really happening as they continue to inhale this and taking their over the acid reducers. Reducers.
And I'm actually in the middle of taking a seminar now. I stay on the computer from about 7:30 till after 10 o'clock every night for several nights in a row. And this is one of the issues that they're talking about, and Janet didn't even know that. The proton pump inhibitors, the acid blockers, are usually for heartburn and acid reflux. It's, I think, the third largest selling drugs in America, and it creates billions and billions of dollars annually. But it also increases your chance of osteoporosis and heart attacks and cancer and all that kind of stuff because you don't properly digest your food. And one of the things that people wanted us to talk about was different digestive enzymes. Normally, you get heartburn because it's something you shouldn't be eating. Wheat is the worst by far.
And when you're explaining digestive enzymes, there's a lot of people that are very confused about a probiotic and a digestive enzyme. There's so many walk in here and say, I need a really good digestive enzyme, and they go for a probiotic, or vice versa. They're like, they grab a probiotic, they really needed a digestive enzyme. What's the difference?
Well, there is a difference, and there is certainly some overlap in what they can do. For example, amylase is for carbohydrates, bromelain is for proteins, and I'd like to stop that list because we have a new product called Quercetin Bromelain Ultra, and it's for people that have joint pains or high CRP or more inflammation in their body. It's got a little vitamin C and magnesium. It's got the quercetin, rutin, bromelain, papain, pancreatin 8 times, and that means super concentrated, lipase, protease, and amylase. And I'm putting people that have high CRP or high chance heart attack and stroke very more cardiovascular inflammation, which would be that type Janet just talked about. So amylase, bromelain, cellulases for fiber, chromopapane for proteins. Then there's invertase, carbohydrates, lactase for milk sugar, lipase for fats. Folks, you need a lot of protein and fat digesting things. And, I know keto's the rage, and I pretty much promote the paleo-keto diet. There's a lot of overlap there, but there is a thing called clean keto and dirty keto. You'll probably lose weight on the dirty keto, but that's not the healthiest way to do it. For carbohydrates, the pancreatin will get carbohydrates as well as proteins and fats, and the papain will too. Pepsin, we sell a lot of betaine and pepsin, and there's just more and more and more of those. So it's very important that you get one that's very well-rounded. We even have one that for people that are more vegan/vegetarian. But my favorite, and this has got our new label on, is called Digestive Essentials.
And we'll quit changing the names, folks. I promise you. That's why one of the big reasons we private labeled is because, these products keep changing. And as we learn more, we keep changing things. We'll be adding more to our line. And, the names just won't be changing anymore. They'll stay what they are. So
she promised. I'm not sure I'd believe that.
I think
but
I promised.
Mostly. Our Digestive Essentials, and I tell people just one per meal if it's a small, healthy meal. Although I do too, because that's what my lovely wife gives me, either because she loves me or because she didn't want the gas, belching, and bloating later. But digestive enzymes are definitely different than probiotics, and they're both very, very necessary. But this has pancreatin, betaine, hydrochloric acid, pepsin, which is super concentrated, desiccated ox bile, which is real important on anybody that eats meat or fat, and even more important on people that's had their gallbladder taken out. Then it's got bromelain and papain, and the only people that shouldn't take this are the people that are allergic to pineapples because of the bromelain.
When you talk about gas, bloating, and belching, many people are listening to this maybe for the very first time, and they're going, well, I have gas, bloating, and belching. What's wrong with that? Doesn't everybody have that?
Yes, men make fun of it, roll up the windows so everybody can enjoy daddy's gas.
And if we don't want to enjoy daddy's gas, what would you suggest when people have this issue? Is it taking a probiotic? Is it doing digestive enzymes? What's causing the gas, bloating, and belching?
The answer to that is take both. And I got that question from a lady out in Utah the other day, and she's hooked up with a really big, nationally known guy. And she says, well, my Labrador Retriever is having horrible gas, bloating, belching, and the gas she can't stand because she's hypersensitive to it, to the smells because she's pregnant. Real sweet lady. And we're starting the lab on probiotics. I think that'll work.
Okay, well, and the other part of a dog even having gas or, that bad type problem is that it's the kind of dog food you're giving them, because a lot of them are filled with the grains in there that the dog just doesn't digest. I know we changed ours to a raw type dog food. We use Primal, and because it's all natural. And even, I know this is horrible, but I'm famous for trained stories and bowel movements. But when our dog goes to the potty to do number 2, within a few days, because that is all so natural, it actually dries up and flies away in the air. It doesn't stay there for long extended periods of time. So that dog food has got something to do with the quality of what they're having or whether they can digest it. And dogs can't tell you how they feel. But they actually are very much, they're a lot healthier if you get them off of those grain-free diets. And I had them on one that was
go grain-free.
Go grain-free, like the raw diet. The one I had was a grain-free, supposedly very good, and our dog was just getting more and more lethargic. And then I noticed when we changed them over to this new dog food, it's like, oh, I don't even have to pick up poop anymore out in the yard because it just disintegrates, kind of like a wild animal. When it goes to the bathroom, you don't see it later on. It just goes away.
And that's why the proverbial question, does a wild bear poop in the woods? Because it disintegrates and we don't know.
I don't know how we rolled down this hill, but we did. Here's our next type of person called stressed out. And, geez, I know a few of us that fall into this category. Their bad habit is overdoing the coffee and booze. Their emotional profile is they are type A workaholics. Means they like to get things done.
We're not talking about Janet.
No, we are not. I just know a few people like this.
Right.
What it means is if your stress hormones are constantly pumping, blood flow is diverted away from your gut, which, people that have this issue, I'm not saying it's me, but they may forget to breathe every now and then. You realize that, oh my goodness, I guess I am not breathing real deep because you're just getting through. It impairs the growth of good bacteria and digestive enzyme production because you are losing blood flow because you're diverting it away. They often have adrenal fatigue, which causes sleep issues, decreased libido, and trouble focusing, among other symptoms. So the ways to heal it, and I think they naturally are driven toward these type foods, is eating salty foods, dark-colored foods.
She eats a lot of salt.
Hey, he's pointing fingers. I tried not to point any earlier. Embrace animal protein and get serious about stress reduction.
I know she's stressed when she eats beef because normally she doesn't eat much beef.
Hey, that's a good point. Supplement with B vitamins and adaptogens. So can you tell us what an adaptogen is, Dr. Lewis? And I believe we may have a new one now that I just absolutely love.
Yeah, it's called stress response, and adaptogen is a herb that will help you adapt to stress. This one has a lot of acetyl L-carnitine in it, and if you know anything about carnitine, it does way too much for us to talk about on this show. It's incredible. Glutamine, that's free form, and that helps heal the guts. Tyrosine, which helps the brain, and the GABA and serotonin reactions. Ashwagandha, that's an adaptogenic herb. Blueberry concentrate for the antioxidants. Ginkgo. And even George Carlin says, if you can remember to take your ginkgo, do you really need it for your memory? Eleuthero extract, which is a major adaptogen, and it's got several other things in it, even some phosphatidylserine, which can help rebuild the brain.
But I have been told that people are taking this, and I have one in particular, a lady that takes it, and she says that she does not crave alcohol like she did whenever she started taking this product. So it's called stress response. People are loving it. I had a school teacher that I gave a sample to. He came back and said, I need the whole bottle. I signed up for a whole nother year. I was just going to go part-time, but it's a whole nother year. Give me the whole bottle.
And he could tell a difference within 30 minutes. There's only about 4 or 5 supplements I can tell very quickly. Stress response is one of those, oh my God, yes, no doubt about it, let's do it.
And things that a person with that type stress gut personality should do is avoid alcohol, caffeine, refined grains, and sugar, as we all know.
Yeah, but it's not happening.
And then we've got the immune gut. There's two more guts here, so if we've not hit you, we're getting ready to. Immune gut is their bad habit is popping antibiotics every time you feel sick. The emotional profile on that is a perfectionist, they're insecure, and they're very detail-oriented. And what it means is food sensitivities, usually gluten and dairy.
They're good to have employed, though, because they're perfectionists.
But if they're taking antibiotics all the time, they're going to be out and sick. The people that are the reasons behind the immune gut, with this type, they usually have multiple allergies and intolerances. It's been caused by long-time use of antibiotics, birth control pills, and steroids. And at its worst results is autoimmune disorders and inflammatory bowel disease. So, Dr. Lewis, there are things that people can do. Can you tell us what that would be, besides doing things like drinking bone broth and eating healthy fats daily?
Yeah, you need to do that. I'm a big fan of keto/paleo, but what you want to do is begin to detox your body gently, but gently does not imply it's not a major detox. And We have a new formula that I just absolutely love because it hits detoxification on several different pathways. It's called Vital Detox. It has the broken cell wall chlorella, which is famous for taking away heavy metals and a lot of other toxins. Then it's got trademarked broccosynolate, which is broccoli extract. And what that does, that's indole 3-carbinol, which turns to diindolone methane, which helps clean up the environmental estrogen mimicking chemicals. We've had people that says, oh my God, within a few servings of this, they could tell they're detoxing by the smell in the bathroom. It also has an enzyme blend because enzymes is what makes these things work. It's got the beta-glucanase, cellulase protease, hemocellulase phytase, and it's really, really, really good, and people can tell a difference. So what you should do is get on the right probiotics. We've got so many different kinds. We've got a urinary tract support formula for probiotics, but it's okay if you don't have a urinary tract problem to take it, and it's like, let me see how many's in it. It's 60, so that could last you 1 to 2 months, and it's got plenty of the lactobacillus in it, and it even has the lactobacillus gasseri, which is one of the ones that begins to help you lose weight. And it's got the KCI, the salvarius, which gives you good oral health in the mouth. Then it's got enough of the bifidobacterium species. I think that's a 25 billion CFUs. And even though it says UT defense, even if you don't have urinary tract, that's a really, really good one to take.
And then the things to avoid is, again, alcohol. Alcohol is always off of here. And dairy, raw foods, and packaged foods. And then maybe that person won't have to take so many antibiotics all the time and start beginning to heal their gut. And our last category is toxic gut. Their bad habit is eating processed or fast foods all the time. The emotional profile is they're impatient. They're frequently frustrated, and they're quick to anger.
Well, that's why they're going through the drive-thru. They're impatient. I want it now.
So what it means is SOS. Eating a high-fat diet or a diet high in fat, sugar, and chemicals causes an inflammatory chain reaction from our liver to our intestines, leading to symptoms ranging from gallstones, which then we get our gallbladder removed, to rosacea and to neurological distress. So beside eating abundance of raw, green, and or sour foods, and drinking like dandelion tea and getting more sleep and meditating, what are other ways that someone with a toxic gut could repair that, Dr. Lewis?
I think the Vital Detox would be a really good thing, and then you want to get back into the probiotics. There's one in particular that I like. It's called Lactobacillus rhamnosus, which is in our UT support formula. It's in our Probiotic 100 billion. And there's 60 capsules there, too. And they're pretty dang inexpensive for what you're getting. It has the Lactobacillus rhamnosus because that particular one and several others have been found to, it reduces anxiety and alters the expression of the GABA receptors. And that means reduce anxiety.
Okay.
So probiotics, let them do the work for you.
And make sure they avoid alcohol and non-organic dairy and produce, fried foods, nut butters, and oils. So there you have the different categories. We've got a couple of questions that we are running out of time, so we're going to run through these quickly, but we want to make sure we get them answered. Brian asks, is Truvia a good form of stevia to use?
My opinion is probably not. It's got a little bit too much alcohol, sugar, whatever that is. I don't think so. As far as the stevia, which is okay, we think Nature's Sunshine brand is probably not the only good one out there, but that's the one we used back when we used to use that.
Cool. And then Kelly asked, is there a way to test gut microbiome? She saw a test advertised saying they could tell you what food you should and shouldn't eat based on the individual microbiome.
You know, I did that test with supposedly the world's best lab, and I was not impressed. And what I found out later was the things I tested positive for were the ones that I'd been eating, and since I have a tendency toward leaky gut, that Candida Gut Janet talked about, it showed that I was sensitive to it, and that's not true. We really have a new set of tests that are coming up. We think we got to make sure it's real. And I've seen people take these gut microbiome tests, and I'm not impressed. We'll talk about hair analysis and how crazy inaccurate they are, but I don't know when we're going to get to that. Should be soon.
Yeah, stay tuned. It's going to be exciting, but I had to get over the excitement of this stress a little bit with the new products. I think we have labeled now about 90-something of them with our own label. So thank y'all for hanging in there. If you're new to listening to our show, please share this podcast with others. Please give us 5 stars on iTunes. I love that. I didn't even know that was happening, but that's fabulous. And if you would like to get started feeling better and not guess at what's going on with your health, go to greenwisdomhealth.com, fill out the health survey. Dr. Lewis will talk to you personally to get you started on which lab panel he suggests to get you on the road back to health and help you. I know you're in one of these gut types we talked about, get you back on the road to feeling good and not craving all these bad things that we're having. So again, thank you for listening to the show. Please give us questions. We love that. Join Dr. Lewis's closed Facebook group, Shootin' Straight. That's where you can find answers to questions. He's on there all the time answering things. So you guys have a blessed week. We will be here next week.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.